Good afternoon, everyone. It is an honor to be with you today. The Illinois Medical District is deeply grateful for this opportunity to present to you where we are and where we're going and what we're all about. And so, my name is Allyson Hansen. I'm the CEO and Executive Director of the Illinois Medical District Commission. And at the Commission, we have learned that patient experience isn't about the moment you're face to face with the doctor. Patient experience starts the moment you try and make that appointment, the moment you step off the bus, the moment you step out of your car. It is that first impression that makes all of the difference. So, before I begin, a little history of the IMD, the Illinois Medical District, because probably most of you do not know. It's a life science and innovation cluster. That's not unusual to China. There are several of those located throughout China. And in Chicago, the Illinois Medical District started because of a very tragic event. In 1871, there was the Chicago fire. And during that fire, we lost two hospitals and one medical school. And it was at that time that the leaders of the city and the state, they recognized we need to put healthcare in a very distinct and safe location away from downtown Chicago. And so they established the Illinois Medical District. Now, we're 10 minutes, less than 2 miles from the loop. So we're really not too far today. But back in the early 1900s, that was quite a distance. So by 1941, the city planners had formalized a general plan. And I love this stacking diagram. I saw this when I first started with the IMD almost 5 years ago, and their plan was beautiful. It was to have this center core of healthcare, of life sciences, of medical schools that would be surrounded by what they called a quiet zone or green space, a place of respite where you could get outside, where you could enjoy. And that would further be encapsulated by housing and communities, and it would connect to other communities in Chicagoland. So this ultimate plan, it really paved the way to where we are today. Today, the Illinois Medical District is the oldest medical district in the United States, and certainly one of the largest. We serve one of the most diverse populations in Chicagoland. Within a couple of miles, you'll find people who speak 12 different languages. We represent every income level, and we carry very different health challenges. We think about the IMD not only as a medical hub, but as a place where the environment becomes medicine. So we're celebrating the opportunity to deliver on that ultimate plan by bringing together connectedness, green space, and accessibility with a clustered environment of health sciences, a true ecosystem where you can live, work, learn, and play. So what makes the Illinois Medical District unique isn't just that we're a 560-acre setting in the midst of Chicagoland. We're really a living lab. We have experiences and experiments running all day long in and around the IMD. Within our boundaries, there are clinicians, researchers, startups, community organizations. We're constantly experimenting with things that are new. We are 7.7 billion in our 560 acres of economic impact to the state annually. Compare that to 2013 when we were 3.4 billion. So we are rapidly evolving and expanding. We do a lot of work with our community, however, because we believe at the end of the day, and I heard it on the earlier panel, it's about building trust. And so in order to do that, we have to work with the community directly. We have a couple of programs just recently that we've started with them. One is a mobile clinical vans trial. So one of the issues with taking things from the bedside, from research to the bedside is the trust and the time of that change management. So we started to look for ways, how do we bring this to the community where they can start to trust and believe it's right for them to enroll? So one of our companies that we've partnered with brings that mobile van in, hires locally from the community, those community health workers, those nurse practitioners, to then educate the community, their neighbor, about why enrollment in a clinical trial is important, why it's important for them and their diverse group to be enrolled in a trial, and how can they do it, and how can they get involved. And so, this is convincing my 4 hospital CEOs and university presidents that we need this outside company to help us do a better job of enrollment in clinical trials. That's not an easy message to deliver, but we all need better outcomes. And so at the end of the day, we're focused on what the future can bring us. Another one that I mentioned earlier was working with the League of Black Women. Black women die from cancer at a 40% higher rate than other groups. Why? Why is this happening, and why don't we know more about that gap? And in talking to some of the vice chancellor of research at UIC, there's studies that show because they haven't been involved in a clinical trial, some of the screenings that are used aren't applicable or as applicable to that group as others. So very interesting outcomes that we're finding as we're working more and more with the community. Care is at the core of all we do in the Illinois Medical District, but the patient experience is more, as I mentioned, more than just the appointment itself. It's about the environment surrounding the care. It's about how easy it is to get into the Illinois Medical District. So we're working with MIT now on how do we improve transit? How do we get more shuttles in? How do we make it affordable so that people can come to our world-class institutions and get the care that they need? And once they're there, how do we reduce their anxiety? By making sure that things are in their language, that it's clear where they need to go, because we're a very busy section of downtown Chicago or near side Chicago. So we really want to make sure that we're accessible. So what we've found with our 4 hospitals is that when we remove barriers, we build trust. Patients show up, they follow through, and then achieve better outcomes. It's basically a domino effect. When patients feel cared for because they can see the environment is cared for and they can tell we've thought about their arrival, they can see that there is trust here, and we begin to build our reputation for a place where you can go to get the trusted care you need. That's a signal that innovation and health equity is real. And this reputation attracts researchers. It attracts top talent. We make great top talent in Chicagoland. We want to keep them here, and we want to continue to have them thrive in our area. So they come to the IMD because it's a place where these ideas can be tested. And they know that there are relationships with the community, so they will be supported. And one of the ways that the Illinois Medical District works with the community is to make sure we've got community councils. So we've got groups of individuals from our stakeholders, from our neighborhoods, from our surrounding institutions that just have a desire serving on our community councils. And we're always standing up a new council. And sometimes we're closing a council because it just hasn't gotten as robust. We're willing to fail. At the center is our advisory board. That's the CEOs and the hospital presidents and the university leaders. And then surrounding that are councils that help guide us. And what should safety and security look like? How can we be more sustainable? What does education need to have in order to be relevant here? And so of these councils, they're meeting monthly and sometimes quarterly in order to keep a pulse on what needs to happen in our community to make us a stronger place. We also have a plan, as most of us do when it comes to getting things done. The first plan is build that trust, get green, look great, have the curb appeal and that great first impression. But our other plan is to continue to attract development. We want to make sure that Chicagoland continues to be seen as a place of innovation, and we want to partner with our friends in China and around the world to make sure that new innovation, think about Chicago, think about what we can offer, and help us understand what you're doing and how can we collaborate. Because at the end of the day, the patient experience is not a Chicago issue or an American issue or Chinese issue. It's a human issue. And that's what we're really all about, building a powerful bridge where we can all cross safely together. So with that, I'd like to share a brief video on the Illinois Medical District. So I'm very proud of where we are today, and I'll do my best to make sure this runs.
There is a place, a community like no other, in a city that makes no small plans and has always dared to dream big. A place where the future of healthcare isn't left to chance. It's deliberately designed and caringly brought to life. Since our beginning in 1941, the Illinois Medical District has been home to trailblazers, visionaries, and innovators working hard every day to improve the lives of people worldwide. One of the largest, most diverse urban medical districts in the nation, and a unique neighborhood that celebrates its storied past with an eye on the future. Just 10 minutes west of downtown Chicago and spanning nearly 600 acres, the IMD is a global healthcare innovation community with unmatched talent, resources, and convenience. A premier destination with easy access to interstates and public transportation, where the sky is the limit. A vibrant community of professionals, students, patients, and neighbors, where doctors and researchers are pioneering life-saving breakthroughs, and where people of all ages come to learn, heal, and grow. With world-class hospitals, universities, nonprofits, hotels, and living spaces, the IMD is a place you can proudly call home. Because when you're in the IMD, you stand on the shoulders of giants, of the generations of ordinary people who dared to do extraordinary things, working to make the world a better, healthier place. Whether you or your business is planning its next big move, no matter who you are or where you come from, the IMD welcomes you. When you start here, you can go anywhere. Write your next chapter and see yourself in the IMD. Made in Chicago, changing the world.
All right, so just thank you again for inviting the Illinois Medical District to come and share a little bit about what we're doing and what we're up to. It's such an honor to be here and to make new friends and to be among friends. So thank you again.